Now we're going to cover one rescuer, adult AED for the healthcare professional. Our scene is safe not only for me, the rescuer, with my gloves and my one-way valve rescue mask, but when using an automated external defibrillator, I think it's vitally important that we're also thinking about the surroundings. Is there combustible gases? Are there liquids that are going to connect the patient with me, and I might become electrocuted when I use the AED? These are all considerations that should be thought about as we're preparing to defibrillate our patient. Now, there's a couple other things that I want to make note of here as we're talking about defibrillation and the adult patient. We get lots of questions from our students about, well, what if they are a female and they have an underwire bra? Is that going to cause a problem with the AED? You know, the technologies are getting so much better now that we tend not to see those complications as often. But if you're thinking about it and you believe that it might be in the pathway, disconnect it so that the pathway is clear for the 2 electrodes to defibrillate the heart. If there's a necklace in the way, we're going to move it to the side. If there's a nicotine patch or a analgesic patch or a nitro gel patch, we're going to take that off and wipe it clear if it's in way of the pad. But other than that, other piercings, things like that, there's no problem just putting your pads in place. Some people have asked, what if they're a drowning victim? Is it okay for them to be in wet clothing as long as the chest is dry? Yes, it is. They can stay in their wet clothes as long as they're not lying in a pool of water or in the water submerged, so that we're not connected to each other when I defibrillate. We should be okay. If it's a pregnant female, there should be no complication other than the fact of understanding that when you're saving your primary patient, the mother, we're also saving the baby in most cases. So we do have 2 patients here, but we have to take care of mom if we want to take care of baby. So we're going to be just as aggressive, and we do not have to worry about hurting the baby and putting them in any more jeopardy than we already know them to be in with the fact that mom is in cardiac arrest. So keep those things in mind as we go through this step by step. We check our patient for responsiveness. Are you all right? Are you okay? They don't respond to my verbal, so I place a hand on the forehead and I tap on the collarbone. Can you hear me? Sir, can you hear me? There's no response from this patient in my taps and shouts. It's at this time, if I didn't have an AED already with me, I would say, you in the plaid shirt, go call 911 and come back. Bring an AED with you if you find one. Or I would call 911 myself and activate a code. But now we have 911 on the way, so I'm able to assess my patient for normal breathing, and I'm going to check for a carotid pulse for no more than 10 seconds. I do not see any normal breathing, and this patient is unresponsive and does not have a pulse. Because I have my automated external defibrillator here with me now, I'm going to turn it on first thing.
Remove clothing from person's chest.
I remove the clothing so I have a bare chest to work with.
Attach pads firmly to person's chest.
The pads have a diagram to help remind me how to put them on appropriately. I put one up here in the top right side of the chest, the second on the bottom left side, mid-axillary, just under the left breast. Now I'm going to plug in the cable. There's only one direction that this cable will go.
Analyzing rhythm. Everyone stand clear.
Do not touch the patient so that the AED can analyze the underlying rhythm of the heart.
Charging. Everyone stand clear. Everyone stand clear.
Make sure that no one's touching the patient as I push the flashing button.
Shock delivered. Begin 5 cycles of CPR.
I'm going to go right into my 30 compressions now. Remember, I'm compressing right over the pads. I'm not moving the pads. I'm going to compress at a rate between 100 and 120 times per minute, and I'm going to compress the chest 2 to 2.4 inches deep. I'm going to give 30 total compressions. Then with my one-way valve mask, I'm going to give 2 rescue breaths.
Seconds of CPR
2
remain.
and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13, 14, 15, 16, 17, 18, 19, 20, 27, 28, 29, 30.
Analyzing rhythm. Everyone stand clear.
I let the AED analyze again.
Shock advised. Charging. Everyone stand clear. Everyone stand clear.
Clear.
Push the shock button. Shock delivered.
Right back
5
into my
seconds of
compressions.
CPR.
We're going to continue this whole cycle of CPR, reanalyzation, charging if it's going to charge, shock, back into CPR. And we're going to continue this until help arrives, until this person becomes responsive and the next level of care can take over.